On July 1, 2008, Dr. Donald Berwick, a professor at Harvard Medical School who later would be nominated by President Barack Obama to run Medicare and Medicaid, spoke at Wembley Stadium in England. He was celebrating the 60th anniversary of the National Health Service, Great Britain's government-run single-payer healthcare system. In his speech, Dr. Berwick said, quote, "Excellent healthcare is by definition redistributional."
You could have had a monstrous insurance industry of claims and rules and paper pushing instead of using your tax base to provide a single route of finance. You could have protected the wealthy and the well instead of recognizing that sick people tend to be poorer and that poor people tend to be sicker, and that any health care funding plan that is just, equitable, civilized, and humane must redistribute wealth from the richer among us to the poorer and the less fortunate. Excellent health care is by definition redistributional. Britain, you chose well.
A few weeks later, on July 26, 2008, the British Medical Journal published a written adaptation of Dr. Berwick's speech at Wembley. In this written version, Dr. Berwick expressed the same view in somewhat streamlined language. You could have a giant insurance industry of claims, rules, and paper pushing instead of using your tax base to provide a single route of finance. You could have protected the wealthy and the well instead of recognizing that sick people tend to be poorer and that poor people tend to be sicker, and that any healthcare funding plan that is just must redistribute wealth. Britain, you chose well. On July 7, 2010, President Barack Obama gave Dr. Berwick a recess appointment to become director of the Centers for Medicare and Medicaid without a confirmation hearing or vote in the Senate. That day, CNSNews.com's White House correspondent Fred Lucas asked White House spokesperson Robert Gibbs if Obama agreed with Dr. Berwick's statement about redistribution in his speech in Great Britain. Gibbs evaded answering the question.
Yeah, just a couple more follow-ups on the Dr. Berwick's nomination. As far as some of the, among the controversial comments that he's made in the past that would have come out in the Senate confirmation hearing are that excellent health care is, well, excellent health care by definition is redistribution. Some of the others were mentioned. Does the president actually agree with that comment?
Look, this is somebody who is uniquely and supremely qualified to run an agency that is important to our government. It's important to seniors. It's important to the implementation of the new health care law. This is somebody supported not just by Democrats, but by, as I said earlier, Tom Scully and Mark McClellan, who ran this agency, both of whom ran this agency for George Bush. So
does the president agree with the
I know that this is the exact type of political game that that the American people have come to understand dominates Washington and doesn't actually make their health care more affordable. April?
One more on this. You said that it would have been, you're confident there would have been a confirmation had there been a hearing, but you also think it would have been politically troublesome in an election year to have all these comments aired out about rationing, redistribution that Dr. Berwick had talked about in the past?
You just read comments. Is there like a secret comment book that somehow you got that nobody else got, and you just read a couple of them to me, and somehow they wouldn't have come out? Did he say things like rationing happens today? The question is who will do it? Did he say that? Did he say that?
That was one comment.
Actually, that was Paul Ryan. That was Paul Ryan. Okay. He's a Republican in Congress.
All right, that's fine. You got your own comments. The
April?
comment I just read.
No, that's not my comment.
Okay,
that's Paul Ryan's comment.
That's your own comment. But the comment I just read to you came straight out
of
the speech he gave in Britain.
No, that came out of Paul Ryan's mouth, the one I just read.
Okay, that's fine.
Rationing happens today. The question is who will do it.
Yeah,
but you thought that Don Berwick said that, right? You told me that?
You asked me. I thought it sounded like the
quote. It sounded like it, but it seems to be the viewpoint of the member of Congress that has spent a lot of time talking about health care, right?
Yes, but
Go talk to Paul Ryan, and I'll be happy to take that question at a later date.
but I've read a separate.
The statement Gibbs presented from Representative Paul Ryan was clipped from an interview Ryan gave to Ezra Klein at the Washington Post that was published February 2, 2010. Gibbs quoted Ryan as saying, quote, "Rationing happens today. The question is who will do it." In fact, Ryan said more than that. His full quote to the Washington Post was, quote, "Rationing happens today. The question is who will do it. The government, or you, your doctor, and your family." Dr. Berwick said something similar to the shortened version of the quote from Representative Paul Ryan that Gibbs used in his press briefing. In a June 2009 interview with Biotechnology Healthcare, Berwick said, quote, "We can make a sensible social decision and say, well, at this point, to have access to a particular additional benefit is so expensive that our taxpayers have better use for those funds. We make those decisions all the time. The decision is not whether or not we will ration care. The decision is whether we will ration with our eyes open. And right now, we are doing it blindly." Nicholas Balsi, CNSNews.com, Washington.